Good afternoon, everyone. I can confirm Western Australia has no new COVID cases overnight, but there will be one case reflected in today's numbers. That was the case the Health Minister outlined yesterday afternoon. That person is a 4-year-old boy who flew into Perth last Wednesday with his mother and his father. His father is the diplomat. The boy and his parents remain in hotel quarantine. WA Health has identified 50 close and casual contacts of the diplomat. In some good news, 41 have tested negative to COVID-19, with 8 test results pending. The 15 close contacts are now in quarantine, where they will remain for 14 days. Our health authorities advise that this is an extremely low public health risk, but we are not taking any chances. All precautions are being taken. It means WA has now recorded a total of 1,110 COVID-19 cases since the start of the pandemic. That brings the number of active cases in Western Australia to 16, of which WA Health is now monitoring. 4 are in hotel quarantine, 6 are in hospital, of which 2 of those are in ICU, and 4 are on a respiratory ward. All are in a stable condition. These are the 6 cases previously reported who are crew members from the Stolt Secura tanker. A total of 12 crew members from the Stolt Secura have contracted COVID out of the 22 crew. One of these crew is being transferred to hotel quarantine so that health can better monitor that person's condition. They don't require hospitalisation at this point in time. At this stage, all other positive crew members will remain in isolation on board the ship unless they need to be transferred for medical treatment. 10 crew members who are not confirmed cases will be retested today. Over the weekend, WA Health was informed that Adelaide Airport had been listed as an exposure site on the South Australian website. Passengers travelling on VA 722 on 1 October from Adelaide to Perth were identified as casual contacts. WA Health has commenced follow-up and testing of these contacts, with 56 returning a negative result thus far. 9 have returned to South Australia and 22 have not met the criteria of being a contact. I'm advised the risk is low, but it's important that anyone who has been contacted follow the instructions they've received. It is with sadness I acknowledge the increasing case numbers in Victoria, where another 1,763 positive cases have been confirmed overnight, along with 4 deaths. This is a tragedy and we expect it will get worse. And I speak on behalf of all West Australians in sending our thoughts to the people of Victoria, who continue to do it very tough. The growing crisis on the East Coast, and indeed globally, means we are obliged to do more to protect Western Australians from this virus. That is why we're announcing a major new step forward in relation to our resources industry and its tens of thousands of workers. From December 1 this year, any FIFO and other workers who work in mining, exploration, oil and gas and resources sites, or work in remote operations, or run critical infrastructure including remote train and port control, will be subject to new directions mandating vaccination. That means to work, they'll be required to have received their first COVID-19 vaccine by December 1. This will also apply to any visitors to mining and oil and petroleum operations and exploration. These workers will need to be fully vaccinated by January 1 next year. The timeline has been reached after consultation with the resources sector, along with union and health representatives, and has been agreed upon to give workers and employers enough time to access vaccination, especially if they are mid-swing. This move is based on health advice and will involve over 100,000 workers. It follows similar moves to mandate COVID-19 vaccination in other industries, including ports, transport, freight and logistics, healthcare and aged care. The aim is clear. We want to protect workers and the wider community and their families, and ensure our resources sector not only continues to thrive and operate, but in doing so powers the national economy during uncertain times particularly in the eastern states. Our goal is also to protect our Aboriginal community and address the obvious risks posed by the movement of resources sector workers to and from regional and remote locations in the state, with many mine sites located at or near remote Aboriginal communities. Resources sector workers potentially come into contact with Aboriginal people from remote communities, which means there is a risk that COVID-19 could enter a community from an infected worker. The mining sector is also the largest employer of Aboriginal people in the regions. Factors which increase Aboriginal people's susceptibility to chronic disease, serious and chronic disease, include factors which increase Aboriginal people's susceptibility to serious disease from COVID-19 include higher rates of other chronic health issues, difficulties in accessing healthcare, and high levels of mobility. I want to thank the resources industry, companies and unions for their cooperation and leadership on this very serious issue. Today's announcement complements other measures already put in place to boost vaccination rates, including pop-up clinics in Pilbara towns. The Perth Airport pop-up clinic, which will operate in partnership with Rio Tinto, opens next Monday, October 11, and will provide a convenient way for FIFO workers to access the vaccine on their way to or from work. Western Australians have done such a good job to look out for each other, follow the rules and crush and kill the virus. But the threat hasn't diminished. The risk is real and it is deadly. We are seeing that play out daily on the eastern coast. It is as heartbreaking as it is confronting. That is why we all need to be prepared for a potential Delta outbreak. And the best way to do that is to get vaccinated. I'll now hand over to the Vaccine Commander to provide an update on COVID vaccination.
Thanks, Premier. Good afternoon. The recommendation by the Chief Health Officer, Dr Robertson, to make vaccinations compulsory for workers in the resource sector will protect tens of thousands of people and help a vitally important industry. The current clinic at Port Hedland, which I visited yesterday, and a further clinic which we are operating in Karratha next week, takes on a new importance for people that live and work in the Pilbara. We also have clinics at Newman, Tom Price, Paraburdoo, Onslow, and a rolling program through some other locations in the Pilbara. At the visit yesterday, I observed that you can simply walk in or preferably make a booking, and the clinic is open between 8 AM and 8 PM all this week until Sunday, and then it will be recommencing in Karratha, and there's a capacity to again do that for 11 days at Karratha, and we will be coming back to both locations for those mass clinics, and in some dialogue with Aboriginal people in Hedland yesterday, we will be making special provisions to accelerate the vaccination opportunities for Aboriginal people as well. While at Port Hedland yesterday we note that 325 people were vaccinated, I expect that number to now grow with today's announcement. We've got the capacity at Port Hedland to vaccinate up to 900 people at the town civic centre in Port Hedland on a daily basis. Our Norwest area is of course rich in history and rich in resources. We need to do everything we can to protect the people and those that live and work in that region. For FIFO workers, as mentioned by the Premier, there will be an airport clinic opened up at Terminal 2 next Monday, and a fortnight later we'll be opening a further airport clinic at Terminal 3. So I ask people to take advantage of the opportunities. Whether you are a FIFO worker getting your vaccination, you can of course book through your GP or indeed a pharmacy, but there are plenty of bookings available. In fact, today we have over 2,000 bookings open today, and we have the capacity to do at least 100,000 vaccinations per week just from the state-run clinics, aside from those that are available through the Commonwealth-led facilities such as GPs and at chemists. So with that, I'll take my seat.
Thanks very much, Commissioner. Any questions for
Do
me?
you know what the current sort of rate of those vaccinated in the industry resources is?
I don't have it at my fingertips, and I think it varies from various company to company. So some employees and some companies are at higher. Some companies are at higher levels than other companies. But clearly, what this measure will do is ensure that the overwhelming majority of people working in the mining industry will be vaccinated as a consequence. This is obviously a tough measure. Other states are doing similar things in relation to various parts of their workforce, but this is what we need to do. We need to do this to protect the industry, protect the workers, protect their families, protect regional towns, protect Aboriginal communities, and ensure that we continue to have a functioning and thriving mining industry in our state.
Will fully vaccinated mine sites avoid shutdowns in any future lockdowns?
Well, no, we haven't committed to that at this point in time. Obviously, we're keen not to have lockdowns. We're keen not to have lockdowns in the future, but we just don't rule them out in limited circumstances. You just don't know what is around the corner. But what this will do is ensure the industry is much safer, the people working in the industry are much safer, the prospects of there being problems in the industry are reduced, and we get higher levels of vaccination across Western Australia.
How's it going to be policed? If a contractor sends a worker up to site, who's going to be checking them? Is it up to the contractor to make sure that they're vaxxed, or is it up to the site that they go to?
We'll work out the directions. So the directions are currently being drafted. So we're working out the directions currently. My expectation is it would be managed by the mine site operators, so that's the major companies, and then we'd have a spot checking regime, if you like, that would monitor that. But I expect, knowing the mining industry as I do, that they'll be very efficient and very good at running this system. And as I can tell you, they're very keen to make sure this system works well and is implemented, because it's obviously in their interests as well as in the state and nation's interests.
Is there a parallel here with, they get RVT, do a breath tested on a regular basis as they go to site? Would they have to produce, some sort of hard copy of their vaccinations?
That's right. Look, a lot of the companies will do it themselves, so they're already putting in place measures to do it. But there'll be some requirement for proof, as indeed other workforces have. So we've now done it for port workers, for healthcare workers, aged care workers, quarantine workers, for some other sections of the economy. It's a natural extension to the mining sector. If the mining sector, over the course of the last 2 years, the mining sector has run uninterrupted. We've had the whole thing operate uninterrupted because we kept COVID out. And that's produced billions of dollars for the Commonwealth Government that they're now pouring into New South Wales and Victoria. And had we had the mining industry closed down or be disrupted via COVID, it would have been catastrophic for the country. So this is just another measure we're putting in place to make sure that industry remains safe, regional towns remain as safe as they can, the workers, their families, and Aboriginal communities are as safe as possible.
Did they come to you and say it would help us as an industry across the board for the government to make it a public health order rather than us individually, each company having to tell their workers?
I think we've had ongoing discussions both with the industry and unions, but I think the most important thing is that we got health advice, that this is the best thing to happen, and we're obviously following the health advice. I think it helps also with compliance if it's based upon health advice from the chief health officer via a public health order. So it allows for better compliance, it allows for better understanding, it's very clear, it applies uniformly. It's not as though one company has it applying and another company doesn't. It just means that it's across the board, easily understood, everyone has to do it, and it'll make things safer, much safer, for everyone working in the industry, and also regional towns. You've got to remember regional towns are not vaccinating as fast as the city. And a lot of the workers go and stay in camps or move into camps near regional towns, and I want to make sure regional towns are kept as safe as humanly possible.
Does it apply to the head offices for some of the big mining companies as well? Because I know, when it comes to random breath testing, they actually apply it to some of their office workers who never go to site.
It applies to those people who go to site or who work in remote operations. So if, for instance, you might have been to the Rio Tinto Operations Centre at the airport, and I think BHP has one in their building where they operate the sort of equipment on site remotely. People working there have to be vaccinated. People who go to site have to be vaccinated. People who live in a regional town and work on site have to be vaccinated. The office staff who don't do any of those things at this point in time, it's not mandatory, but I'd encourage them to get vaccinated. So I know the companies overwhelmingly want all their staff vaccinated. The health advice at this point in time does not permit us to enforce it at a state level, if you like, for the people in the offices, but I'd certainly encourage all those people to get vaccinated in their own interest.
Is the industry expecting to lose many workers over this?
I wouldn't think so. I wouldn't think so. You know, working in mining is a sought-after job. It's generally high paid, and it's a very good career path. And all we're trying to do is keep it safe for everyone who works in it, their families, regional towns and Aboriginal communities.
Are you expecting backlash from the unions?
No. Look, I think if it's done by the Chief Health Officer and a public health order, it just makes it easier to manage. And that's what's happening here. It's a public health order. We'll publish the advice from the Chief Health Officer later on today, but I just think it makes it easier for everyone to manage and understand. And as I said, it's not piecemeal, so it's not one company doing it, and the mine site next door not doing it. This measure means that it's just uniform across the board, easily understood and easy to comply with.
And why mining and not the construction industry? Is it that interface with Aboriginal communities that you're worried about?
Well, it's based on the health advice, but if you're working in construction on a mine site, you're required to get vaccinated. If you're working in oil and gas or exploration, you're required to get vaccinated. If you're working in construction on an oil and gas site, you're required to get vaccinated. So it's based upon the locations that people go to, their proximity to regional towns, Aboriginal communities, the value of the industry to the entire economy. You've got to remember, without the mining sector, as I've said repeatedly, not well understood in the East, without what we do in our state, without what that workforce is doing in Western Australia, the whole country would be in massive trouble. And those huge bailout packages that the Commonwealth is putting into New South Wales to keep them afloat would be very difficult to fund. So it's in everyone's interest, including the eastern states, that we put these measures in place.
Ahead of the border coming down, will the construction industry be reconsidered for mandatory vaccination, and also things like supermarket workers?
We progressively consider industries based upon health advice. As I've said to you, there's a whole bunch of industries and workforces that it's already been put in place for. And we'll continue to do that over time to mandate further industries over time. But today is a big deal. This is over 100,000 workers here that will be part of this. Other industries will deal with progressively.
We're 5 days into mandatory vaccinations for Tier 1 public health sites. Has that had any impact on the operation of hospitals or emergency departments that you're aware of?
Not that I'm aware of.
Just on, while you're up there, Premier, just on travel, apparently Bali's going to open up on October the 14th. And some people, not us obviously, but some people around Australia may be tempted to go there. Is that something that you would ever consider?
Not to Australians, I don't think. So I don't think it's open to Australians.
It's just, well, when it becomes available, when Australians are able to travel, surely they can go to Bali.
I think when it opens up, it's not to Australians.
Yes, October 14th is the date, but they're talking a couple of months later, Australians will be able to travel.
We will get back to international travel eventually. It may be a few months after people in New South Wales. But I just remind you, if you travel overseas from New South Wales to many countries, your chances of catching COVID are less than in New South Wales. So for people in New South Wales, travelling overseas is actually safer. For people in Western Australia, it's not. And so therefore, we'll obviously be behind New South Wales in opening up to international travel because we don't want to get COVID in here before such time as we have extremely high levels of vaccination. So I think our measures just make sense. They're basically cautious, sensible, preserving the great lifestyle and great health outcomes we have, preserving the great economic outcomes we have, just means we'll be a few months behind potentially New South Wales and Victoria. And I remind you, states like Tasmania are exactly like us. I realise in Sydney all carry on over there. Seems to just focus on Western Australia and Queensland to an extent, but Tasmania and to a degree South Australia are exactly the same as us. Don't want to get COVID before such time as we have very high levels of vaccination and we have the right measures in place. We've examined and have the right measures in place to manage it if and when it gets here.
And one more, which is a bit left field, but there's a few hundred protesters demonstrated outside the Australian consulate in New York over our mandating of vaccines. They were very vocal. You're
Really?
surprised that they've discovered us?
Saying Save Australia, right?
Yeah.
Is the Trump Tower nearby?
They marched from the...
They came from the Trump Tower?
A lot of them were teachers, and they marched from the New York Bureau of Education to our embassy or consulate.
They want to save Australia from what?
The
Tyranny of
disease,
lockdowns.
lockdowns, COVID.
What about vaccines?
You're surprised that
Yeah.
they've taken an interest in Australia.
A lot of things about America don't surprise me anymore, but this is obviously, we won't take any notice of that. It's just silly. I mean, honestly, protesting in New York, you might recall last year, New York, where they were basically digging mass graves on islands in New York to bury people who are dying, and they were stacking them in freezer trucks outside hospitals, telling us how to conduct ourselves. I mean, seriously.
Gollum, sorry, not Gollum.
John Quigley's not here.
How are you looking? Are you looking forward to working with the New South Wales Premier, who I think referred to you as Gollum? You or John Quigley? I don't know which one it was. I think it was you.
Oh, well, look, firstly, congratulations to him on becoming Premier of New South Wales. It's obviously a great honour and no doubt fulfils a long-term ambition that he has held. But I understand today he has criticised the GST deal, in which Western Australia gets 70 cents back for every dollar we put in. New South Wales gets 96 cents back for every dollar they put in. So clearly the deal is weighted in favour of New South Wales over Western Australia. The New South Wales government have been very poor financial managers. They now have massive deficits and massive debt. They managed COVID very badly, and you can see the consequence, what's happening in New South Wales now. And so instead of looking in the mirror, they look west to blame us for their situation. The reality is, but for our efforts to keep COVID out and keep our industries open, the huge bailouts, $1 billion or so a week going into New South Wales, would not be possible. So rather than attack Western Australia, they should be grateful for what the people of this state have done in order to continue to fund their states. He's been the Treasurer now for however long, but New South Wales' financial performance has been appalling. Obviously, we have managed our finances far better. We handed down our budget recently, $5.8 billion surplus. They've got deficits in the tens of billions of dollars. So clearly, we won't cop any stick from them.
Just to quote him though, he says that WA needs to come to the table and hammer out a new deal that's fair for the country. And he's not the only Premier that takes the view that we're taking more than our share.
Yeah, the threat is real. It's a clear and present danger to Western Australia, and there's little appreciation or gratitude for what we are doing for those states by producing the massive revenues the Commonwealth is pouring into those states. So clearly gratitude is in short supply over there, but we'll continue to do what we do, which is keep our industries open, provide that huge support to the eastern states and continue to prop up their economies.
Have you rung to congratulate him on his appointment?
I wouldn't know his number.
Do you think the GST is more under threat with Mr. Perrottet as Premier?
Yes, I do. He's a relatively young man, so I assume he'll be around in the role, although New South Wales premiers turn over pretty quick. But they've got so many I can't keep a track of them. They're like prime ministers. They turn over very quickly. So I assume he'll be around for a while, and clearly his sights are set on undermining our revenue, our GST. Just so you completely understand, when you go to the shops and you spend $10, in New South Wales, they get back 96 cents in GST. In Western Australia, we get back 70 cents in GST. So they are already receiving far more per capita than we receive. Yet they want to further take revenue away from the state that already supports them to a massive degree.
Won't the real danger, though, be because you've got commitment from Morrison and from Albanese, that it will be the review in 2026? That's the danger.
It's a 2025, 2026 review, and obviously that will be upon us before we know it. And, you know, people like Mr Perrottet, no doubt, will try to use that and any other mechanisms at his disposal to undermine the deal that Western Australia has. Look, to be frank with you, I'm tired of listening to their whinging. They never stop whinging. And the reality is we have supported them far more than they support us, and they should stop trying to undermine the deal that just gives us 70 cents for every dollar we put in. South Australia gets around $1.50. Tasmania gets $2 for every dollar they put in. Northern Territory, $4.50. Victoria and New South Wales around $1 for every dollar they put in. We get 70 cents.
There's speculation that Gladys Berejiklian might run for federal parliament. Is that appropriate for somebody under ICAC investigation, do you think?
I don't know the truth of that. I saw the story in the paper today. I would expect... Yeah, I saw that. I would expect anything of that nature would be dependent upon what happens with the inquiry. I would have thought that they would be well advised to wait.
Hospital capacity in Queensland came under scrutiny today because they're saying dozens of code yellows in a month over months in recent times. I mean, we had 500 code yellows over 12 months recently. So how confident are you that we're ready?
I am confident.
For when the virus gets here?
I am confident. We will do all we can to keep it out until such time as we have very high levels of vaccination and we have the right public health safety measures in place and we have the right contact tracing measures in place. So that's our plan. Our hospital system has been under pressure. It's no secret, as has South Australia's, Tasmania's, New South Wales, Victoria and Queensland's. They've all been under huge pressure. The South Australian Premier raises it virtually every National Cabinet meeting, how much pressure their system is under. Whole range of reasons behind that, but we have plans in place for what to do if and when we get an outbreak.
Just backtracking all the way to the diplomat's case, I think you said there are now 50 contacts in that case. That seems a high number for a family that presumably landed at Perth Airport and got transported straight to this apartment complex. Who are all those people?
I don't have that detail, but there was a housemaid, there was the driver, there's probably their family contacts and who they may have been in contact with, and any staff or employees at the hotel and their families. So we're very precautionary about it. So we extend it's like a family tree, it branches out.
10 close contacts, the others would have been casual, so people who come in contact with close contact.
Yeah.
Could I get the...
Any more for me, Rhiannon? You're right? Okay, thank you. Who did you want?
the police
Commissioner?
commissioner. A couple of issues, please. Just on COVID, firstly, we had someone up at the Joondalup Health Clinic today, and there was not a soul there. Well, they were, but no one else and staff. That must be increasingly frustrating for you to know that there's a clinic there willing to jab someone's arm and you can't get anyone through the door.
So it is a case that in many of our metropolitan clinics they are being underutilised. I've sort of taken upon myself to, communicate probably every day, multiple times, and then if I think I've done too much, I need to treble it. We just need to continually remind the community, do not be apathetic about this. Do not think that you can get through this period where we don't have COVID in our community and not be vaccinated. I can't keep repeating myself to the point that people will stop listening. The reality of it is that we have many vacancies. We've got 2,000 appointments available today. That's the briefing I took about an hour ago. We have up to nearly 100,000 available per week. Now, many of those are booked up. As a strategy, what we are doing is bringing forward a lot of those bookings from mid-November and bringing them forward into October. So we sent an email out to all of those people who've made those bookings on Monday morning. And what I expect is that as we then start to fill, what we don't have is clear vision of the amount of people that receiving vaccines through their GPs or pharmacies. So I met with e.g. a pharmacist in Headland yesterday, very proactive pharmacist, and he's doing as much as he can with the new Moderna vaccine that's been rolled out. But the underutilisation of Metro, I'll be actually redistributing some of that staff, e.g. to the country, so we're putting some additional up into the Pilbara to cover off some of those low uptakes.
And so mandating FIFO, have you got any idea how much that might boost your bottom line or your jab numbers?
Well, we've had discussions obviously with the CME and with individual companies. I had some discussions with BHP yesterday. I expect that aside from company incentives, the mandating of this vaccine and the headline dates of 1 December will no doubt accelerate. There's an estimated 140,000 people that would fall within this particular mandated regime. That will no doubt incentivise a lot of people. Like, they need to do this to keep their jobs, but to keep protecting the community and themselves. It's not just about their employment, it's about those they live with, those they socialise with, and we need to do it for the entire community. What I have got an estimate of is that we will, on the basis of 70 to 100,000 vaccinations per week, which I expect today's announcement will accelerate things, that we will easily meet the target that we'd set earlier in the year of minimum 80%. We obviously want to get much higher than that by early December. So I expect it'll accelerate things.
So you still think you're on target for early December?
Yes, we do.
That email that was sent out on Monday, I think, so that went to people who have bookings in November onwards, asking them to reschedule for October, is that
yes,
correct?
That's correct.
What was the thinking behind that?
Well, the thinking is to actually accelerate these vacant booths that we've got at the moment. That is a source of some concern and frustration, because I've got staff that are sitting there waiting to vaccinate people. We know that we need to actually lift up the uptake. All we can continue to do is message people. So, look, there's a very strong message to people working in the resource sector today, but you would expect that the community don't have to all be mandated. I mean, these are mission critical, vital industries to keep our economy and all the social well-being that we enjoy keep going. But there's a whole body of people that need to get vaccinated anyway.
Do you know approximately how many people that email went to?
No, I don't have that, but we can get that back to you.
On another issue, the two blokes who met and bought high-vis vests and snuck themselves into the stadium during the grand final, larrikins or irresponsible?
Oh no, totally irresponsible. We can't condone that sort of behaviour. I mean, Optus Stadium is a wonderful venue, but it is a critical piece of social infrastructure for the community, and you can't have situations where people just walk in. So I know that the management of Optus Stadium and Venues Live will take that extremely seriously, and they are. Police will work with them as to whether there's any criminal offences, but as I understand, they went through a staffing gate there, but clearly that's unacceptable and it's potentially criminal.
Well, so how potentially criminal off the top of your head? What could they possibly be charged with? Because they were invited in, and I think that's what people are reassuring them of. You're invited in, so you're home and hosed.
Yeah, if they get there under some false pretence, then it still is potential trespass. But we will work with Optus Stadium in regards to that, because you certainly don't want that to be repeated, certainly during a public event.
Strangely, though, they could, get massive YouTube numbers now out of this.
Yeah, look, I don't find it entertaining. I mean, they might, but I think the general community would be sharing our concern that you don't want any sort of fractures in any of our major public stadiums, because it obviously needs to be a situation where we're all confident that those people that are inside major public events are authorised to be there.
How are you managing misinformation? Because just listening to Talkback Radio this morning on this announcement, there were a lot of people calling up with concerns that are from misinformation.
So there's a lot of FAQs that we have on the wa.gov website and the Healthy WA website. There's a lot of misinformation out there. In my visit to the Pilbara, that reinforces once again people who will readily follow social media and uninformed, unofficial information, which is often misleading and false. So with that, look, we live in this wonderful community where we've got the freedom to choose whatever we want to read. There's no sort of restriction on that, but I once again implore people to read the official literature, and plenty of that is available.
I mean, they're probably not the sort of people going to read the FAQs though, so does more need to be done?
So in particular communities, for instance, I'm meeting with members of particular faith groups and the cultural and linguistically diverse community. About 50 of those leaders are coming tomorrow to meet with me and some senior health officials. That's an opportunity to explain to them directly about the need to take official advice, because we do know, and I wouldn't want to particularise the diverse communities alone, but we do know that some people will listen within, I guess, tight circles rather than be properly informed. So we continue to do that with many groups to make sure they get the right information.
You haven't, I know the Premier has referred to some of these very extreme religious groups that have infiltrated these some of these Aboriginal communities. Do you have any powers to, I don't know, get them out or weaken their influence, or is it just talk?
We've had long-standing arrangements where there are restrictions on people actually physically visiting, so those sorts of people that are putting this dangerous information out cannot physically attend, but of course we can't control social media, so people are networked and some of them watch satellite TV, and they have private Snapchats and all sorts of social media that they get information from. What we are doing is proactively working with elders, working with people with cultural authority, with faith leaders, to make sure that they actually understand and appreciate the risk. And we are aware of a small number of communities who are resisting. I've sent senior respected law people and other people of faith into those communities to try and countermand and properly inform those communities who sadly are being misguided.
What would you say to any politicians who haven't been vaccinated at this stage?
Get vaccinated.
Is it something that would surprise you, that there might be some MPs within the system here?
Look, it would disappoint me, because they are leaders in our community, so I would expect that they should be vaccinated, set an example.
Has a decision been made yet on whether vaccination will be mandatory for school leavers hoping to attend official leavers events?
Yes, look, I've got advice from the Chief Health Officer who's supportive of that, and that'll be a situation where we've already worked with Red Frogs and advised them. They're the body of people, which does include volunteers as well. Last November we had about 1 in 3 of the ATAR school leaders, about 9,000 school leavers at the Dunsborough event last year. So if you can get 1 in 3 of the ATAR cohort, many of them have been vaccinated already, a number of them have, but that will be a case that they will have to be at least vaccinated with 1 jab. And we will have a pop-up clinic, not only in Dunsborough, but we'll have some in Busselton and Margaret River as well.
So they will have to get 1 jab at least. And when do you get that message out to them, given that a lot of them would have made bookings?
They've got that message already. I'm sure they're well connected.
Have they been told that?
Oh, by media.
Okay.
I don't think it's been officially
I don't think it's been officially announced yet.
I'll take it as official now then.
That's what I'm saying.
All school leavers.
I saw it in the media yesterday,
Well,
so...
it was speculated.
Oh, did you? Oh,
Sort
okay.
of, kind of.
Let's take it official.
How about we sort of strengthen that, given that...
Well, it is.
Yeah.
I've just said it.
Okay,
So what I have to do is await for the Chief Health Officer to formalise his advice. He told me as recently as about 2 hours ago that he's agreed with the request I put to him to consider it. He agrees that it should be done. Once I get his advice in writing, we'll formalise that in a direction. But I've got no difficulty in saying that the Chief Health Officer agrees that this is a proper way to mitigate against it. And when you think about it, the state is underwriting this event, which is popular. It's a good event, it's well managed, but what you can't have is an unrealistic expectation and Gary, you might laugh at this, but I don't think social distancing is right in their cohort. So, you know, what we have to be is realistic about it and say they're a group that are vulnerable to COVID-19 infection. As a state, if we're going to sponsor this, and we are, and it's a very well-run event, and we don't want them, you know, wandering all over the place. And so while they can enjoy themselves in a structured, managed environment, we have a lot of first aiders, a lot of counsellors, a lot of people to support them. With that sort of good, clear management, then we should, in fact, provide as best protection as we can. And protection in the form of vaccination will be a requirement.
And would you have a vax clinic down there?
Yes.
You will have.
Yes, there, Margaret River and Bustleton.
And for those who are vaccinated, you've got to bring your certificate?
They'll have to produce some evidence. Yeah. So before you get your wristband, you'll have to provide evidence of vaccination.
So this is just down south, we're talking about Dunsborough, Margaret River?
No, we're talking about the main Levers event at Dunsborough.
Dunsborough.
Yeah, but there's a lot of the Levers get accommodation in and around that area, including Margaret River and Bustleton. So we'll make facilities available to get vaccinated there as well. Ideally, look, we're about 6 weeks out from this. They should get vaccinated before they get down there.
So no excuse, there's enough time.
There's enough time.
Do you think vaccines and alcohol mix?
Well, that's one of the reasons why we would want to have people vaccinated well beforehand. You know, it's one of those challenges because there is some clinical safety requirements, and certainly drinking and vaccination should not occur simultaneously.
Thank you.
Okay, thank you.